Well, unfortunately, we've got several wards that have been affected, quite a significant number of patients that have been affected by norovirus. And this is really concerning us at the moment because it is affecting our ability to admit patients, because we can't admit patients into a closed area. So this has been a real impact on our emergency department. The most important thing to stop norovirus spreading and coming to hospital is to self-isolate. Norovirus is a short self-limiting infection in a healthy individual. You can have symptoms for 2 or 3 days, but you're still infectious for 48 hours after those symptoms have stopped. So it's really important not to come to hospital, to try and self-isolate at home, be rigorous with hand washing at all times to minimise that spread. Norovirus can present, it's a naughty little virus. It can present in a number of ways. Predominantly it's diarrhoea and or vomiting. It's usually a sudden onset. People that have experienced it will know suddenly you feel very unwell, you can appear grey in colour, you can have a temperature, you feel very tired, you're off your food, and the vomiting is very often projectile. Not all people do get vomiting though, so it can just be down to diarrhoea, and you can still spread it in exactly the same way. I think people need to be aware that, as I said earlier, healthy individuals, it's a short self-limiting infection, you get better, and after 48 hours of being symptom-free, you're at no risk to anyone. But in our very vulnerable patient group here at the Royal, then this condition can be fatal. So one of the steps that we may have to take if this continues is that we may have to stop visiting to our wards, and that's something that we really don't want to do. But our patients need to see their loved ones. But we have had incidences this year where families have visited their loved ones whilst they've been symptomatic with norovirus, and that has caused norovirus to come into the hospital, and now we're struggling with the consequences of that. So that's something that we don't want to do, but that could be our last resort decision.